Welcome to United We Spay, the show dedicated to promoting affordable spay-neuter services nationwide. Each episode delves into the heart of the movement, sharing inspiring stories and driving positive change. Our goal is to raise awareness, educate, and empower, addressing overpopulation's root causes to ensure every animal has a chance for a better life. Hosted by Stacy LeBaron and the United Spay Alliance team, we're on a mission to change lives. Fed up with the fixation on symptoms in the animal welfare conversation, it's time to change the narrative. Join us on United We Spay, where we make a difference by spreading knowledge and building a compassionate world for animals. Let's put prevention first and spotlight spay-neuter in the animal welfare space.
You're listening to United We Spay, podcast from the United Spay Alliance. The United Spay Alliance works to promote accessible, affordable, and timely spay-neuter services because an ounce of prevention today can prevent untold suffering tomorrow. Spay-neuter, it's public health for pets. And I am Stacy LeBaron, United Spay Alliance board member and host of the show. And today on United We Spay, we have Dr. Michelle Gonzalez, who is founder and veterinary medical director of the Rascal Unit. Dr. G graduated from the Ohio State College of Veterinary Medicine in 1999 and completed an internship in small animal medicine, surgery, and critical care from the University of Missouri in 2000. After 6 years in private practice, she started the Rascal Unit, a mobile veterinary clinic that provides affordable and accessible veterinary care throughout the state of Ohio. The mission of the practice is to decrease euthanasia and pet surrenders due to financial reasons. We provide high quality, high volume spay, neuter, and wellness care to dogs and cats cared for by rescue groups, and owned pets and community cats is what the Rascal Unit folks do. Welcome to the show, Dr. G.
Thank you so much, Stacy, for having me here.
So before we jump into talking about all things mobile, which is an incredible passion of mine, why are you so passionate about spay neuter?
I mean, why not, right? It's the best way to help control population. I always think about the problem, the solution, the source of the problem. We look at shelters and the overpopulation, and that is not the problem, right? That's what happens because of the problem. The problem is of the overpopulation is all these animals that are just reproducing. And the way to control this reproduction is by sterilizing. So if we are able to stop that reproduction, then we are going to stop the euthanasia, all these problems that are happening. And realistically, a lot of people want to take care of their animals. They want to be responsible, and they're unable to do it, whether it is because they don't have access to care or they cannot afford it. So we are doing our part to bring that service to people and, help them take care of the problem where the problem happens.
I still run into so many people saying to me, oh, I know, aren't people terrible? They just don't get their animals fixed. They don't get their pets fixed. They don't care about animals. What would you say to that?
I think that there are two parts of that problem, right? There are people that don't do it because they're not educated. They don't understand the importance of it. And we cannot fault people for ignorance that comes due to lack of education. If they're doing it because they don't care, it's one thing. But if they don't do it because they don't understand the why, it is our duty and our obligation to explain to them why. The other side of it is that I meet loads of people that want to do what's right and they just can't. The majority of the people that come to us, they beg us. They say, I want to get my dog fixed and I just can't do it because I can't afford it. Or I've been trying to get my dog to the vet for the last 6 months, 8 months, a year, and I can't get an appointment and they can't do it. So before we are so judgmental, we need to figure out why people are not doing it. In my experience, most people want to be good pet owners. There's just some barrier to them being so.
Yeah, one of the phrases I'm starting to use a lot is the term moral distress, which is many of us know what we should be doing, but we just aren't able to provide those services. And I know in the veterinary profession, we talk about economic euthanasia a lot because folks will bring their animals into the veterinarian and their animal will be in distress or need services immediately. They can't afford it. Therefore, they say, we just have to put this cat down, right? And so the veterinarian and the staff, they're conflicted because they know that this animal does not need to be euthanized. There is a way to help and save that cat or dog, but they can't because they don't have the ability to do so. So it's different than compassion fatigue. It's moral distress, which is we know what to do. We could do it. We just aren't given permission to use those resources to do it. And I think that also falls within the general population too.
Yeah, and that affects both the owner and it affects the veterinary team, right? And we end up in this, I say, in this blame game because the owner is going to blame the veterinary team with the whole, you don't care, you're just about the money. You don't care about my pet. You're not helping me. And then the veterinary team says, you don't care about your pet. You're not paying for your pet. You got this pet and you can't afford it. So you should not have a pet because nobody wants to take the blame. Nobody wants to take the responsibility for not being able to take care of this animal. And in the end, the one that suffers realistically is the animal that's not getting the service, the care that it needs. But, there's no need for everybody to suffer. Instead of playing this blame game, everybody can potentially work together so that we all take care of each other. And the owner is taken care of, the veterinary team is taken care of, and more importantly, the animal is taken care of.
So you wear multiple hats with the Rascal Unit. You're also a teacher, and we're going to talk about that too. But before that, I want to share with folks that you did an analysis of the state of Ohio. And because you have your mobile clinic, which goes around to different locations, and you asked yourself, well, where should I go? Should I just park in my backyard and let people come? Or are there certain locations that I should be moving this clinic around to in order to be more impactful? Tell me your thought process on that.
Yeah, so when I started doing this, the whole idea came about, I'm in central Ohio, right? And I was working with rescues, and these rescues were bringing me animals weekly. They're bringing me like 15, 20 animals to get sterilized. And I'm starting to think, where are they getting all these animals? And they say, well, we're coming from Southern Ohio because they don't have vets there. And I thought, what do you mean there's no vets there? I was really ignorant. I thought everyone has vets. And they said, no, there's no veterinarians in Southern Ohio. So I came up with this idea of, okay, well, I'm going to get a truck and I'm going to go to Southern Ohio and I'm going to, again, take care of the problem at the source. So I didn't do it. I would love to say that I had this, great business sense and all this, and I went down and I figured out, yeah, this is where it was needed. No, I was like, well, I'm going to take the truck and go this. But it was amazing that the places where it was needed were the places that asked for help. So as I created this map of where the Rascal Unit started going, it created itself. It naturally formed itself based on what we consider veterinary deserts, right? Like all the places that do not have veterinarians. So jump ahead 15, 16 years later, Dan Spihar makes this map of locations in Ohio that have lower income and then also are veterinary deserts. And as he's putting this map up and he's talking about, these are places where there are no clinics for TNRs and all that stuff. And I'm looking at that map and I'm like, I recognize this map. This is my map. This is the map where we traveled to. And it was really amazing to see that, it just makes sense, right? So if you listen, if you look with the areas that are in need, it just makes sense, right? And you can bring the service to those locations that are in need.
So the mobile clinic, the Rascal Unit, I think you have 2 or 3 vehicles?
We have 3 vehicles currently that are on the road.
Yeah. And then you tell me, who do you service with the Rascal Unit?
So we service anyone within the state of Ohio. We're licensed in Ohio. And we go through hosting groups, which are humane organizations. And through these hosting groups, we basically help either the hosting group itself. So we will go and work on shelter animals, whether it be dog pounds or TNR groups, but we also help the community animals, and we'll help people like their own pets or people that are helping TNR and that kind of stuff. And we are not income based. So realistically, anybody that has an animal that needs assistance are able to come, because the reason I don't like doing income based is that you may not qualify for income assistance, but that doesn't mean that you can afford to go to a vet or that you have access to care, right? You may have a good job. You may not need income assistance, but you have 3 pets and you cannot afford to pay $600 per dog to get them spayed, right? So we just want to help anybody that needs help to take care of their animals.
And when you say that you don't require income verification, but you have these hosting groups, so they are the schedulers, they're the ones who get all the people together to bring their animals in, they do the reminder calls and all that kind of stuff. Are they, though, you're giving them guidelines to follow by to ensure that when folks are coming in, that they're all prepared, for their pet to have surgery or the adoption programs animals to have surgery. And then you are paid by the hosting organization. So you're really taking a lot of that administrative stuff that some of these clinics get bogged down in. It's taken off your plate and put over at the Humane Society, right?
Right, exactly. And it serves 2 purposes, right? Because it does take a lot out of our plate. And that helps us keep our costs down because we're not having to do a lot of the administrative stuff. But the most important part of that is the cultural competence that it brings to it. Is that when I go to Athens County, for instance, I don't live in Athens County. I don't know what the needs of Athens County is, but the Athens County Humane Society and the Athens County Dog Pound, they do know. So I leave it to Athens County to do their own scheduling. They know if they need to schedule cats. They know if they need to schedule animals from Coolville this week, if they need to schedule more cats than dogs, if they need to schedule more feral cats, right? They know what they need to schedule. And sometimes they need to subsidize some clinics. Sometimes they need to charge an admin fee, right? They know what they need to do. So I tell them, hey, I'm coming over and you can schedule 50 surgeries. But what surgeries you schedule, it's up to you because they're going to schedule what their community needs. So yes, it helps me that I don't have to worry about making all those phone calls and collecting the fees and all that stuff. It helps me significantly. But then also it helps them to be able to take care of their problem how they need it. Because Athens needs are different from Richland County needs are different from, everybody else's needs.
So, and then you say like 50 surgeries and that would equate to X dollars, so it's sort of a contracted rate for the day, basically.
What we do is we do have a minimum that accounts for our overhead costs, but the minimum is met very, very easily because we don't want the organizations to be out any money, right? So we do have a minimum to hold them accountable so that make sure that they are scheduling appropriately. But what we do is we tell them the number is more to make it worthwhile for us to travel because we want to make an impact. We don't want to go somewhere and only do 10 surgeries when we can go somewhere else and do 50, right? Our goal is to make a big impact and help as many animals and as many individuals as possible.
Right. Excellent. And so if I'm an organization, I could choose to get prepaid clients so that then I know I have the money up front. And so it's not so vulnerable. Or you can choose to say, pay when you show up or in the morning before check-in. That's the organization's choice. They're making that decision on their own.
Right, exactly. And there are some groups that will that will subsidize because, for instance, we have groups that help on-house individuals or individuals that have limited income that do need assistance and they will get grants. So these individuals are not paying for anything or they're maybe only paying $10 for the surgery. So the hosting groups have the ability of choosing how that all of that is going to be. We just have a set fee per surgery. And then we tell them this is how much we're going to charge per pet and per procedure. And then they can choose to manage that however they see fit.
How long is a day on the mobile spay-neuter clinic and who drives the vehicle? It to some folks, it just seems incredibly overwhelming because you're driving this whole vet clinic to a location. So, what does a typical day look like on a mobile spay-neuter clinic?
It can be overwhelming. I was actually talking to one of my techs who was saying that we're a special breed, right? This is not for everybody, but those who this is for, this is your life. This is what you just want to do. Who drives this? I drive it. I have a couple of staff members that drive it. Our full day tends to be about 12 hours, 10 to 12 hours. The reason they're that long is that we're traveling throughout Ohio. We're right in central Ohio, which is great because everywhere that we travel is within 2.5 hours. But because of that drive, we're driving 2 hours. We have a 6 to 8 hour day, and then we have another 2 hours back. So our days end up being 10 to 12 hour days. And then we're doing about, again, like 30 to 50 surgeries. 20 of those tend to be cat neuters. So 30 either dog space, dog neuters, or cat space, and then 20 cat neuters. And we also do other procedures, though. We will do some dental cleanings, and occasionally we will do some mask removals. And, we go to places where people have no options for anything else. So we end up doing mask removals. We'll do enucleations. We do whatever it is that we need to do to improve the quality of life of that patient.
And do you bring like multiple vehicles sometimes and do like two teams, and maybe you can segue into some of the educational stuff you do, because I think you use two vehicles when you do have your educational programs going.
Yeah, we do sometimes bring multiple vehicles, which is beneficial, especially in places that will go, if we're going somewhere far, if we're going to a TNR clinic and we want to do like 100 cats in a day, we'll bring a couple of vehicles. And yeah, it's really beneficial when we bring the students, because we can have, a couple of doctors and then, 6, 8 students, and then have everybody doing something. It's a great educational experience for the students, not just to get their hands-on experience in doing the surgery, but also for them to see the impact that it causes in the community. We were talking about the compassion fatigue and about all of that, emotional trauma that occurs when you have to say no. These students get to go to these locations and they get to help the animals. And then they see an animal that needs something, again, like a cat that comes in and the eye is infected and it needs an enucleation or something. And they'll tell the owner, hey, the cat needs this process. And the owner says, I cannot afford it. And they can say, you know what, there's this grant and we can take care of your animal. And then that person starts crying out of, because they're so grateful, and they'll give them a hug. And there's no feeling like that, right? So they get to understand why they became a veterinarian. And there's no feeling like it.
So, and with the students, you have a pretty large group of students, and you have said within a couple of weeks, you have them pretty significantly involved in the surgery process.
Yeah, what I do is we have a very step-by-step process, because I like for them to be very confident and very efficient and skilled in every step before they move to another step, right? So even if they have to be stuck in a cat neuter for 3 weeks, they're going to be the best at a cat neuter that they can be, right? Because it's all about confidence. I just want them to feel good about what they're doing and be really good at it. And it's also, there's the whole see one, do one, teach one. I want them to be able to do it, and I want them to be able to pass it forward. I want them to be able to teach somebody else. So they come in, they learn to do a procedure, they get very, very efficient at it, and then they have to teach somebody else that's new how to do it. It helps us in that they're providing services. They increase the number of surgeries that we can do by providing services. They're usually helping the shelter animals, so more shelter animals can get done. But then they're also helping us teach the next generation of students. So it's increasing the number of teachers that are available. So, we're growing. We started with 1 student, and then the next year we had 3, and then the next year we had 30. So we're hoping to keep growing with that.
Wow, that's excellent. Music to my ears, for sure. And so this is at Ohio State, the College of Veterinary Medicine, that you're conducting this program. And, I'm curious what your thoughts are with regards to the state of veterinary practice as it pertains to going into surgery, or even in the high quality, high volume spay neuter techniques. I mean, we're trying to make it cool to be a high quality, high volume spay neuter vet, right? And that's a subsection of surgery in the veterinary community. And I get the feeling that not as many new veterinarians out there really want to do surgery, but maybe I'm wrong. I am not in the veterinary space. So what are you seeing with the students that you have? I know you've got the ones that love surgery, but maybe you're seeing some other students out there too.
Yeah, I think that little by little, less and less veterinarians are graduating wanting to do surgery. And it's really sad because when I went to school, everybody wanted to do surgery. Even if they didn't want to be surgeons, they wanted to do surgery. And I feel like when I went to school, everybody thought that we had to do surgery. So it was kind of like, it was implied. You were going to be a vet and you were going to at least be doing spays and neuters. Even if you were a farm vet, you were going to be doing, like the cats and that kind of stuff. So now I feel like that's not what's happening. So with this mentorship program, I feel like we're making it cool to be a spay neuter. And the students that are coming here, they're having a blast, right? They're coming in, they're doing spays and neuters, they're working with their peers, they're working together. It's a very kind of non-judgmental environment. And I say kind of because I rag them all day. I mess with them all day, and I don't baby them, but it's very lighthearted. And, they come in, they learn, they want to do it, they want to learn. And I don't know, I guess I make it fun to be a surgeon. And they look forward to the next day, to the next time that they're coming in. So hopefully we can grow some more high volume. And I'm not expecting all of them to go into high volume sterilization clinics, but if at least I can get them to do whatever it is that they're going to do and spend some days, even if it's a couple of days a month, doing a clinic, going to a shelter or going to a high volume clinic, then I call that a win.
Do you believe that the high quality, high volume spay neuter techniques should be known by all veterinarians?
100%, because it's better patient care, right? I see the way that my patients recover, and I see the way that patients that have big incisions and spend long times under anesthesia recover, and it is a huge difference. My patients, their temperatures stay warm, right? They're not under anesthesia for a long period of time. The incisions are small. They wake up, and especially the younger ones, the pediatrics, they wake up like nothing ever happened. The problem is almost keeping them quiet, because they wake up and they're happy and they're back to eating, and everything is I don't know, it's so much easier, as opposed to when they have this big incision, and the incision, it takes longer to heal, and it looks more painful. And again, like the patients are colder and it takes them longer to recover. So I feel that it's so much better patient care.
And when we think about the high quality, high volume spay neuter techniques, it's not just the veterinary technique. There's this whole flow from the technician side that enables the veterinarian to focus on those techniques. How have you structured, your flow for the mobile clinic environment?
Yeah, I tell everybody that I cannot do what I do without my team, right? Everybody has to be on the same page. So my technicians are well trained to be able to do the things that need to be done for me to be able to do what I do. And it starts from when the patient comes in and gets evaluated, and making sure that that patient is a good candidate for surgery, and then sedation and induction and anesthesia. And then after surgery, getting them recovered. Everything has to come into play. So, even bringing it back to, I used to work in an AHA accredited veterinary hospital, right? So everything was at a different standard that working in a mobile truck. And we still used high quality, high volume sterilization techniques. So the only difference is we had different type of paperwork, and we had a lot of different things that we had to do to have those AHA quality standards. Yet the procedure, the process, and the surgeries were exactly the same as what we're doing in the trucks. And AHA was perfectly fine with that. That means that what we were doing as far as the surgeries were to AHA standards.
Many clinics require a pre-visit, and then the person goes home, and then they bring at least the cat or dog back to the clinic for their spay-neuter surgery. Those of us in the high quality, high volume spay-neuter space, we pretty much do everything one and done. Mm-hmm. It all happens in the same day. Do you feel that is different? I mean, why are we different than the other protocol?
I mean, I think the best way I can say it is, for instance, like fear-free. I am fear-free certified. And I believe in a lot of the fear-free techniques. However, I am unable to practice completely fear-free. Why? Because what we are doing is different than what you would do in a general practice. And it is all about, how do you say, the nature of our practice. So what we are doing, it's about the service that we are providing. We do not have the ability to see a patient and then have that meeting and have that discussion and have that talk and send them away. And in part, that is why you're paying a higher fee to meet with the vet and, go to a brick and mortar facility and have that examination and have that visit and have that, all of that, and then come back at a later time. So if you have the time and you have the funds and all of that stuff, and you want to create that visit, then that's fine. That is for some people. But the service that we are providing is a completely different visit. It's the same thing as with with like the trapped cats or even cats that are coming in for surgery, that in a regular clinic, they would say, oh, if you're going to take the cat out and the cat is really stressed out, then you just put it back and then you send it home and you send it with some gabapentin and you give it a feel away and you do this. Cats that come in for me to get spay and neuter, we can't do that. So even though they're going to be stressed, we have to manage, and we know that we're going to stress them, and it hurts me that we're going to stress them, and we're going to do it with the least amount of stress possible, but we don't have another option because it is the nature of what we're going to do. And thankfully, it's a one and done. We're going to do that and it's going to be done, and then they're not going to have to go through that again. But it is the nature of what we're doing.
And I also think about the downstream consequences of not getting that cat spayed,
right,
because there's going to be a lot of pain and suffering if there's a litter of kittens under the porch of somebody's house in the backyard. So there's significant reduction in potential pain and suffering for the kittens that would be born if the service wasn't provided. And I think sometimes people may not really think of this as this holistic situation where we talk about spay neuter being public health for pets, and getting those cats, in my mind, spayed neutered is improving their health substantially. And so it's the first step, and it's a necessary step that we need to make sure that we are able to offer throughout all of our communities, regardless of what their economic levels are and, ability to access that vet care. I just think it's really important that we understand that we have to get these cats spayed or neutered in order to help them. And I think I have rescued an unneutered male cat in my backyard, right? That was nobody else's cat. And I, of course, immediately got him neutered. There's no way I was going to take an unneutered cat into my house. And so by getting these cats spayed or neutered, somebody has invested resources in those cats, and those cats have a better chance of having community members have a relationship with them in some way, whether it's bringing them in, feeding them more, giving them housing, get that ear tip. They know there's a rabies vaccine and they know they're spayed and neutered. So it's a huge, huge step and improvement in the quality of life for those cats to get them spayed or neutered.
Absolutely. And we often find problems, like we'll bring them in and they'll have ear mites, or they'll have dental disease, they'll have abscesses, they'll have, problems that you would not have known otherwise. And you bring them in and you're able to take care of those problems, and you improve their quality of life. So even if they're not going to come in and be an indoor pet, just taking care of that problem and then returning them outside, they have a better quality of life.
Yeah. Dr. G, if folks are interested in finding out more about the Rascal Unit or would like to ask you questions about how you operate your program, how would they do that?
They can visit rascalunit.com. We have our information about the vehicles, and even our services and pricing are available there. So if anybody has any curiosity or about what services we provide, and then if they want to get a hold of me, if they have questions, drg@rascalunit.com is my email. I'm horrible at reading and responding to emails, so bombard it because it takes me a minute. But yeah, you can get a lot of information from our website at rascalunit.com.
Excellent. And anything else you'd like to share with our listeners today?
Yeah, I mean, if you're interested in helping the community, target it, consider mobile clinics. It'll change your life. It's amazing. It's great.
Thank you so much for listening. If you like this episode, be sure to share and subscribe. We release a new episode every month, digging into important conversations surrounding spay-neuter throughout the U.S. and around the world. Find more resources for spay-neuter and learn more about our work at unitedspayalliance.org. That's unitedspayalliance.org. Get in touch with us anytime by emailing info@unitedspayalliance.org. Thanks so much and have a good day.